Paeditriacian and Mother and Child Hospital. Don't know if I've met some of you. If you have other children, maybe I've met you, maybe not. But hopefully we'll meet ourselves very soon. Okay. All right. So how are you all doing? How is the pregnancy going? Hope no morning sickness. Hope you're not too tired. Hope you are fine.
Yes, I'm fine, thank you.
All right. So I want to briefly talk about newborn nutrition, okay? As we're getting ready for our babies to come, there are one or two things we'd like to let you know about feeding of the baby, what to do, what to feed, how to feed, and then how to transition from breast milk to other foods. It's going to be an interactive session, so I'm going to ask questions at a different point in time, and then we can answer. Feel free to answer. There's no wrong answer. We are all learning, okay? So we're talking about newborn nutrition, emphasis on breastfeeding, what constitutes balanced nutrition or complementary feeding, and how to wean off a baby from breast milk. If you have any question at any point in time, just feel free to just interrupt and I can answer the question. So newborn nutrition, can we see my slides? Okay.
Yes.
Yes, we can see.
So I'll just do a basic introduction. I'll introduce exclusive breastfeeding. Then we'll talk about the benefits of breastfeeding. Then mention about positioning and attachment, complementary feeding, and then weaning. So basically, the first 2 years of a child's life are particularly important, as optimal nutrition during this period reduces the risk of morbidity and mortality, and thereby bringing about a better overall development for the child. Optimal breastfeeding is so important and very critical that it can save the life of 820,000 children under the age of 5 years each year. So you can see that breastfeeding is extremely important because it also reduces the risk of mortality, of illnesses, and the risk of dying in children who are less than 5 years of age. Now, what are the recommendations? We usually recommend that there should be early initiation of breastfeeding within 1 hour of birth. So once a mother puts to bed within the first hour of birth, whether it's a CS or vaginal delivery, we encourage that the child should start breastfeeding within the first hour of birth, okay? And exclusively breastfeed for the first 6 months of life, and subsequently introduce nutritionally adequate and safe complementary foods at 6 months of age. And breastfeeding should continue for up to 2 years of age or beyond. So we don't just stop breastfeeding at 6 months. You can continue for 2 years or beyond. Beyond can be as long as you want to. But like I said, breast milk is really very important. It's been shown that breast milk provides half of a child's nutritional needs between the ages of 6 months to 1 year, and 1/3 of a child's nutritional needs between the ages of 1 year to 2 years. So breast milk is very important, and we usually encourage breastfeeding. When we say newborn refers to a child in the first few, a newborn baby, okay? So the first few months of life is very critical. And we will always encourage giving the children breast milk. There are reasons for why we ask for exclusive breastfeeding, but we're going to go ahead and talk about exclusive breastfeeding. Before I continue, okay, let me just show one more slide. However, many infants and children do not receive optimal feeding. For example, only 45% of infants aged 0 to 6 months worldwide were exclusively breastfed over the period of 5 years. So the research was done by WHO to look at how many people are being breastfed in the last 5 years, and only less than half of them were being breastfed in the last 5 years. Shows that the rate of breastfeeding is really very low worldwide. Okay, so I'll ask a question: what is exclusive breastfeeding, and can we define exclusive breastfeeding? Can anyone define it for me? Anyone? What you know? Should I pick someone's name? Anyone? Nobody? Can we guess? It's meant to be an interactive session, so we're going to ask questions. Okay, someone is talking. No one is saying anything.
Hello, good morning.
Exclusive. Okay.
I think exclusive breastfeeding is when a baby is fed only breast milk.
Okay, only breast milk. Beautiful. Any other definitions again?
Exclusive breastfeeding is when a baby is fed only breast milk from
For the
birth
what?
to 6 months or 1 year.
Okay, for birth to 6 months. Okay, that's good. Any other definitions, or should we just go ahead and take a definition? Right, so those are very, very lovely answers. So I heard us say that someone mentioned that when a child is giving only breast milk, when a child is giving breast for the first 6 months of life. Okay, so exclusive breastfeeding, according to WHO, exclusive breastfeeding is when an infant receives only breast milk from his or her mother or a wet nurse for the first 6 months of life. No other solids or liquids, with the exception of drops or syrups consisting of vitamins or minerals or supplements or medicines. So when a child receives only breast milk on demand, and that demand is day and night, okay, and that's another definition, for about 8 to 12 times a day, with no other added things, so no water. Some mothers will come and make me and say, oh, my baby is on breast milk and she needs water. How can you eat food without drinking water? And I tell you that breast milk has a lot of water. About 85% of breast milk is made up of water. So you don't need extra water with breast milk. So no pap, no water. So breast milk only, except when the child is sick and needs to take things like drugs. That's not, you can actually give. But if there's no need for medicine or supplements or anything else, breast milk only. And breast milk is given on demand. So when the child will know that you would say, when the child wants to suck, so demand can be anytime, and then day and night. So you breastfeed in the day, breastfeed at night, and on demand, okay? For the first 6 months of life. Not for the first 2 months, that's not exclusive breastfeeding. Or mothers say, I did 3 months, that's not exclusive. So it has to be 6 months, first 6 months of life. Okay, because at that point, the baby's gut is still not as mature. So you would need to, breast milk contains basically everything the child will need for the first 6 months of life. Everything the child will need, from proteins to nutrients to other things the child will require. That's what we call exclusive breastfeeding. Now, why are we preaching on breastfeeding? Why are we hammering on exclusive breastfeeding? We had the breastfeeding week sometime, I think 3 weeks ago, and we're still trying to talk about breastfeeding. Why is breastfeeding so important? Why is it beneficial? So let's talk about the benefits of breastfeeding to the baby. So why do you want a mother to breastfeed her child? Now, breast milk contains ideal nutrition for your baby. It contains everything your child needs for the first 6 months in the right proportions. Everything your child needs in terms of nutrients, vitamins, immunity, antibodies. So it contains everything your child will need for the first few months of life. And its composition even changes according to baby's changing needs during the first month of life. Breast milk contains important antibodies. So when you start to breastfeed, there's this initial yellow milk, which is called colostrum. Colostrum is high in antibodies, okay? And these antibodies are necessary to fight off infections in your baby. So it has high antibody loads, which helps to fight out viruses and bacterial illnesses. And this is very important in the first few early months of life, because at that time, we realize that the baby's immunity is important to fight off any infection. So breast milk protects your baby by providing antibodies to fight your baby, fight viruses and bacteria from your baby. And formula does not have any antibodies. So when you give your child formula, it does not have the natural antibodies that you would naturally give a child when you breastfeed. But babies who are formula fed are more vulnerable to things like diarrhea, pneumonia, and infections. But formulas do not contain antibodies to fight infections. Breast milk also reduces the risk of some illnesses. Yeah, studies have shown that those who breastfeed their children, there's a reduced risk of illnesses like ear infections. You know, when a child is having maybe discharge from the ear, respiratory infections like cough and catarrh, diarrhea. Those who are breastfed have less risk of having allergies, because putting a child on formula feeding, for instance, makes them more prone to having allergies later on in life. Some have shown that if you breastfeed the child is less prone to having things like diabetes, even childhood leukemia. Leukemia is cancer of the blood. And it's shown that children who are breastfed have less risk of having childhood leukemia or sudden infant death syndrome. So breast milk is really important in reducing the risk of diseases in your baby. That's one of the reasons why we should try our best to see if we can exclusively breastfeed. Breast milk also promotes babies' healthy weight. Now, children who are breastfed, it's been shown that they have a hormone called leptin. Now, this leptin regulates fat stores. You know, when it comes to malnutrition, it can either be the child is underweight or obese or overweight. I know most mothers want their children to be very fat, very big, very robust. But if a child is also overweight, because we have seen that when a child is obese from childhood, can lead to adulthood obesity. So most obesity starts from childhood, and when a child is too big, it's also not a very good sign. So these hormones in breast milk help to regulate fat storage. And then also children who are breastfed have this kind of bacteria in their gut that also helps also regulate fat storage. So most babies who are breastfed tend to have good weight. They're not overweight. Okay. And then some mothers do not know how to mix the formulas very well. So either they're putting in too much water or too small water. Then you realize that the child can either be undernourished or not properly nourished. So breast milk helps the child to grow well, grow healthy and all. Then breastfeeding makes children smarter. Some studies have shown that people who have been breastfed actually have a higher IQ compared to those who are not breastfed. Okay, it shows that because of the physical intimacy, when you're breastfeeding your child, you're bonding, child is looking into your eyes, it's that physical touch. So they tend to be more, smarter. Then there's also some other things in breast milk that also help to promote the child's IQ. Other than that, they also seem to have less issues like learning disabilities as they grow older, and tend to be smarter and more versatile adolescents from studies that have been shown. So breastfeed your child can probably be, the next Albert Einstein or the next, very, very smart. So breast milk is also very important. Now, breast milk is also good for the mother. Some ask, okay, it's not about the child too, right? It's also good for the mother to breastfeed. It's been shown that when you breastfeed, it helps you to also burn more calories, and you tend to also lose more weight when you are breastfeeding. So for those who want to snap back, fit fam, you want to go back from your pre-pregnancy weight, breast milk has been shown to be helpful. Now it also helps your uterus to contract. It's a hormone that is released during breastfeeding called oxytocin. Now remember that once you start breastfeeding, for those who have had children before, once you start to breastfeed, you notice that this pain you feel in your abdomen as your uterus contracting. So it helps your uterus to come back to the normal size it was before pregnancy. Also, it also helps to reduce the risk of bleeding after delivery, because this hormone helps to, help the uterus contract. So it's less likely for you to bleed. Those people who do not breastfeed tend to have more bleeding, and because the uterus does not tend to contract on time. So it also helps your uterus to contract. These are also benefits for the mother. So you can see breast milk is good for the baby, also good for the mother. Okay. Then breast milk also has been shown to reduce risk of diseases like, for instance, the risk of breast cancer and ovarian cancer. These are #1 killers in women. Breastfeeding has been shown to reduce the risk of cancer like breast cancer and ovarian cancer. Breastfeeding has been shown to lower the risk of diseases like hypertension, heart disease, type 2 diabetes, and also arthritis. So breastfeeding is also very beneficial for us as women. So you can see that as a woman, you want to breastfeed because you can reduce the risk of having certain kinds of cancers and certain kinds of diseases just by breastfeeding. Okay. Then it also can prevent menstruation. So when you breastfeed effectively for the first 6 months, sometimes your period may not come. That can be a form of contraceptive. So we call it lactational amenorrhea. So at that point, you might realize that you may not easily get pregnant. Of course, nothing is 100%. So don't quote me. It's nothing 100%. But as I said, it can prevent menstruation. So for the first 6 months, it's a form of family planning for you. Then lastly, it saves time and money. Formula is very expensive these days in the market. Cheapest one is about 2.6. Child will take a formula every 3 days. So you can see that, it saves time. It saves money, time to wash bottles or wash your cup and spoon, sterilize, make sure everything is properly warmed. When you want to go out, you have to start thinking of how do I keep my milk warm? How do I prepare milk outside? Breast milk is perfect. There's no warming, there's no putting it in the fridge. You don't have to wash your breast each time you want to breastfeed. It's just clean at the right temperature. So it saves time and it also saves money. Okay. Are you still with me, or should I pause? Any questions so far?
Where are we
For now?
ma'am?
Okay. And it has been shown to also reduce the risk of postpartum depression. So some women have a bit of depression after pregnancy. So those who adequately breastfeed have been shown that they have a lesser risk of being depressed, so having what we call postpartum depression. Now, who knows what positioning and attachment is? Who has heard this term before? Positioning and attachment. Do you know what it is? Who has heard about it before? Positioning and attachment. Okay. So basically, like I said, the woman in the picture looking very frustrated. Now, breastfeeding can be a very frustrating experience if we don't know how to properly position and attach your baby. Now, it's something like if you come to hospital I try to guide every mother I see on how to properly position your baby to breastfeed. Because if you don't do it rightly, you end up with sore nipples, cracked nipples, a frustrated mother and a frustrated baby. So we don't want that. So we try to teach you how to hold your baby to breastfeed. What is the best way to hold your baby? How do you make sure the baby gets the optimum breast milk while you're also not stressed? Because breastfeeding is not meant to stress the mother. It's meant to be an enjoyable experience between the mother and the baby. So you don't after breastfeeding, you're not having chronic back pain or you're always tired. No, it should be a time of bonding. So we want you to enjoy the experience too. That's why we're talking about positioning and attachment. It's very important in breastfeeding. Now, what is positioning? Positioning and attachment are terms used to describe how to hold your baby at your breast so that they can feed. Correct positioning and attachment is the most important thing for successful breastfeeding. So if you want to know how to position your baby, of course, this is the most important thing for you to do if you want to properly breastfeed. Now, attachment is also known as latching on. When your baby is well positioned and attached, they will find it easier to feed and you find it much more comfortable. Now, I always do a practical for every mother I see, but let me walk through some steps with you. If you have any questions, please ask me. But each time you come to hospital, if I'm going to see you, I will still teach you one-on-one how to go about doing it. And we're nurses are also here to also guide you to make it very easy for you to breastfeed your baby. So basically, how do we attach? The steps to follow. Now you hold your baby close to you with the nose level to your nipple. Okay? Let your baby's head tick back so that the top lip will brush against your nipple. When the baby's top lip brushes against your nipple, the child naturally open his or her mouth wide. And then you now bring your baby to your breast. Some mothers tend to bend all the way down. No, that would hurt your back. Bring the baby up towards your breast, not for you to bend all the way down to the baby. Imagine if you breastfeed like that for 6 months, hunching all the way down. Realize that you start having a terrible back pain, and then you now want to switch to formula because, doctor, I can't continue any longer. So bring the baby up towards your breast, okay? And then aim your nipple for the roof of your baby's mouth. Then when the baby attaches, don't just put only your nipple in the baby's mouth. The nipple and the black part around your breast is called the areola. That also, most of it should be in your baby's mouth. If the child sucks only the nipple, you now end up with cracked nipples, sore nipples, painful nipples. And then imagine if your breast is so painful and tender, you won't want to breastfeed. So the baby should attach not only to the nipple, but the black part called the areola. So that should enter into the baby's mouth too. Okay? Then when the baby is properly attached, the chin should press into your breast. Your baby's nose should be seen clearly. Some mothers, when you're breastfeeding, they tend to use their breast to block the baby's nose. No. There's a way you should put it, the baby's nose should be seen clear because babies breathe with their nose. And once their nose is blocked, they'll take their mouth off your breast to be able to breathe. Okay? So the nose should be at a tilt when attached correctly. In the correct position, your baby should be able to suck, swallow, and breathe comfortably. You hear your baby will be swallowing. You hear some swallowing noises. Say, okay, I'm doing it right. And their cheeks will tend to appear fuller than normal when you're properly positioned. And then you should not hear things like smacking sounds, things like or clicking sounds. Once you hear those kind of sounds, the child is not attached properly. Do you understand? When you're hearing or some smacking sound or clicking sounds, that means the baby is not sucking properly. You need to adjust the baby again. And when you're feeding, you should feel comfortable. If you're feeling uncomfortable, then there's a problem somewhere. And your nipples should not be sore. In the first few days, of course, when you start breastfeeding, you feel a bit of funny sensation when you start, like a bit of uncomfortable or sensation, but it should not be pain. Once you're feeling pain during breastfeeding, that means there's a problem somewhere, and you have to teach you how to properly attach the baby, how to properly position the child. Okay. So in summary, is the picture what I was trying to show you. When you bring the baby to your breast, you aim the first one shows that you aim the nipple to face the roof of the baby's mouth. The child now latches on. Notice that the nipple and the black part, most of it are inside the baby's mouth, and the baby is sucking. Okay, and that way, see that most of it, the baby can actually suck comfortably. So not just the nipple only, but the areola. So this is something what I was trying to explain. So if you can position properly and attach properly, it's very important in breastfeeding. Don't worry if you didn't get what I said. When you come to hospital, we'll always give you a practical session, okay? Because this is one of the key reasons that will determine whether you successfully breastfeed or not. So when you come around to see us, we will walk you through what to do. Then some women have some issues like flat nipples, inverted nipples. If you do, please let us know during your antenatal class so we can your doctor's visit, so it can help you to work on your breast before you start to breastfeed, so that you don't end up, having, sore breast. What happened?
We can hear you, but you are breaking a bit. Dr. Funso. Hello, Doc. Dr. Funso, are you there?
She's no longer here.
Okay, are you still hearing me? Okay, something
Yes.
happened. I can't seem to hear anyone. Are we still know what the problem is? Are you also hearing me?
Yes.
Not. Okay. So sorry, I don't know what happened. All right. So I mentioned we're talking about complementary feeding.
We can't see your screen anymore.
You can't see my screen. Oh wow. Happened. Sorry. Okay, let me see. Don't know what happened. Sorry, just 1 minute. Let me get back to it and see. Sorry about that. All right, so I think I should share the screen again. All right, so share that again.
Yes, we see it now. Thank you.
Can you see my screen now?
Yes, we
Yes.
see it now.
Yes, we can see it now.
Can you all see my screen?
Yes.
Okay. So we're talking about complementary feeding. All right, okay. So complementary feeding. So what do we know as complementary feeding? What is complementary feeding? All right,
Hello?
so let's just talk about, so anyone wants to answer?
Okay, so the first part was exclusive breastfeeding, where it was only breast milk introduced to the baby by the mother. So I assume that complementary now is no longer exclusive to just breastfeeding. So maybe some other type
Okay.
of
So do you know what complementary feeding is? Sorry?
no, I don't. So just an effort to try.
Doctor, we lost you. We can't hear you again.
I was a bit distracted, so sorry about that. Complementary feeding is so when the child has been breastfed for the first 6 months, And then after 6 months, the child will require other things. So when you start introducing other food to the child, so around the age of 6 months, an infant's need for energy and nutrients starts to exceed what is given by only breast milk. That's when you start introducing complementary feeds. So complementary feeds are other foods like solids, family diet, okay? And at the age of 6 months, an infant is developmentally ready for other foods. If it's not introduced by the age of 6 months, they tend to falter in growth. So it's very important that at the age of 6 months, the appropriate foods have been introduced the appropriate foods. And when you say appropriate foods, you should aim to give the child, things that are well balanced. The child is moving from what's the word? Moving from liquids to maybe semi-solids, okay? From semi-solids, then example to that things like mashed foods and family diet. I usually advise parents that when you want to start child complementary feeding, be patient. This is a child that has been on breast milk only for the first 6 months of life. So at the time of giving child semi-solid food, the child may not initially collect the food from you. He or she may fight with you, may not want to take it. Keep trying, okay? And try to be patient with the child, okay? And then if you want to introduce a food, try to give at least 3 days in between introducing a new food. Because if you give a new food, for instance, if you introduce too many things at the same time, if a child reacts to one, you will not know which one the child reacted to. If you want to start pap on Monday, you can start pap, then maybe give it from some few days, and maybe on Thursday, introduce banana. So that way, you don't put too many things at the same time on the same day. So if the child starts stooling or reacting to one, okay, it's pap, you can know which one to withdraw. All right. So the guiding principles for appropriate complementary feeding are as follows. We said that breastfeeding should continue until 2 years of age. Then practice responsive feeding. For instance, feed the child slowly and patiently. As I said, encourage them to eat, but please do not force feed children. There's many practices that we do here in Africa, whereby we turn the child upside down, close the nose, and try to force feed the child. Please do not do that. Many children have died from being force fed, because once it gets into the airway, it can be deadly. A child can die from having food lodged into the child's airway. So please do not force feed the child, okay? Talk to the child, maintain eye contact, try to be, to lovingly go about it. Some children, of course, can be stressful, they may reject the food. At least try 10 to 15 times before you now say, okay, I'm not doing it again. So keep trying until you switch to something else, or just keep trying, okay? Then practice good hygiene and proper food handling. When you're feeding the child, do not share the child's cup and plate with every other member of the family. Try to keep their own things properly cleaned and hygienically, prepared very hygienically. Then at 6 months, start with small quantities of food and increase gradually as the child gets older, okay? So you can start with maybe small pap, maybe like once or twice a day. Then as the child gets older, you begin to increase the child's food consistency and begin to increase the variety. You see that for a child who is about 6 to 8 months of age, you can do 2 to 3 meals per day. A child who is 9 months to 2 years of age, you can do 3 to 4 meals per day with a snack or 1 or 2 additional snacks in between. But the key to complementary feeding is that one needs to, at this point, to be extra careful, because if you don't get it right, it's when a child can now become malnourished. I have so many babies who are very fat when they're in the first 6 months. When the mother starts giving the child food, the child suddenly becomes very sick and now becomes malnourished. As I said, it's a gradual process, and we're here to help you out. Always feel free to reach out to us, the nurses, the doctors. We're here to talk to you. If you have any challenges with introducing complementary feed, you can come and meet us. We can give you a meal plan. I'll give you ideas of things to start giving the child, and then we'll work with you to see how we can assist you through your journey. So just know that you're not alone. So we're always here to assist in any way, okay? Then let's talk briefly about weaning. So we can now ask 1 or 2 questions before we round up. Now, what is weaning? Weaning is a process of which a baby slowly gets eating family or adult food and relies less and less on breast milk. The process varies from culture to culture and is regulated by the child's individual needs. And weaning can be in 2 ways, can be natural or planned. Natural or planned is that it can either be natural now begins to accept different types of solid foods while breastfeeding on demand. So the child is one that begins to detect the pace of how he or she would want to feed. Okay, so babies who are naturally weaned usually
I know now. That's what I was telling.
We can't hear you, ma. We can't hear you.
Can you hear me?
We can't hear you, doctor.
Oh, wow. Can you hear me now?
Yes, we can hear you now. Welcome back.
can hear
You
Yes,
can
we
go
can hear you
ahead.
now.
Sorry, the network is really, I don't know what happened. All right, so I just went through weaning. I mentioned that weaning can be either patient-led or, mother-led or child. The child can lead the weaning process. I mentioned that when the mother leads the weaning process, it's called planned weaning, or naturally when the child decides to, do the process weaning by him or with herself. And I tried to talk about that when you're weaning of a child, that you should start it gradually, and then it should be just follow your child's cues, okay? And then it should not be done abruptly, because if you stop breastfeeding at once, you may start having difficulties, engorged breast, and it can lead to some infections called mastitis. I also mentioned that when you're also weaning, how to take care of your breast as a woman is that you could still express down to keep yourself comfortable, or you could use some, ice packs on the breast so that it will reduce the feeling of maybe pain or discomfort you may feel while weaning. And if you have any issues while trying to wean, like maybe blocked ducts or swollen tender breast, feel free to contact any of us, and we'll also be there to assist you. Sorry for the network issues. All right. So do you have any questions? Or you still can't hear me?
Yes, please. Good morning, doctor.
Good morning.
As a matter of fact, I have a question, then I have a comment too.
All right.
Okay, yeah. You mentioned that if someone has maybe like a flat nipple, or I don't know the other type of nipple you mentioned, I should see. Please, can you like speak more on that, like make it clarify that. What do you mean by flat nipple, and then the other one, I don't know.
Inverted. So
Inverted nipple.
thank you for your question. So some people's nipples are flat. Not everyone has like outside protruding nipples. Some people's nipples are, instead of coming out, they enter inside. We call it inverted. Okay. Those can bring about some challenges while breastfeeding. Okay. So what we usually advise is that people that have flat nipples while you are pregnant, you could try to use your thumb to try to pull it out a bit while you throughout your pregnancy. So that way it gets used to coming out. Yeah, so those who have like severely inverted nipples, we can advise you to get what we call nipple shell. And nipple shell can be worn inside your bra while you are still pregnant. So that will help to bring out pressure to push out your nipples while you are pregnant. So that should be done during pregnancy. Because if you don't work on that while you are pregnant, when you give birth and your breast becomes engorged, it can be a problem. So and the more engorged the breast is, the more a flat nipple will enter inside. So we advise you to keep trying to pull out the nipple. You could just use like maybe lubricant like Vaseline, just to pull it out with your two thumbs. Roll it out with your thumb, just to pull it out throughout pregnancy. Just keep doing that regularly, so that by the time you're ready to breastfeed, the nipples will be ready and it will not be inside. So is that flat or inverted? Some people are born that way. It's an anatomical thing, but it can be worked on while you are pregnant. Once you start breastfeeding, once you give birth, it will not be too difficult for you to breastfeed.
Okay, all right, thank you. Oh, okay, so yeah, I said I had a comment. Yeah, so okay, I'm a first-time mom.
Okay.
And so I joined the this antenatal class maybe I think I've just done like 3 classes so far.
Okay.
And so I don't have too many questions because I don't have a lot of information. When you have information, you can have questions, but I don't have information about a lot of things. Like I didn't, the first time I joined, the class I joined was they're talking about labor and complications in maybe premarital, something like that, about labor and delivery and all that. Like, and then throughout the class, yeah, it was more like, for me, it wasn't, because that was the class I was starting with. And then for me, as much as it could have been educative for a lot of people, it was not for me, because even as at that time, I was still dealing with nausea, and I had nobody to walk me through that. And so I came in, I registered, there was nothing like nobody walking me through what I needed at that point in time. So and then I think for the next 2 appointments, I didn't get any notification of class. I had to ask the next, like the second time I was coming for the appointment, that is there no antenatal classes? Like, and then I was told that there's one online that maybe I had the do not disturb this thing, and then I need to deactivate that, which I did. So, but my question, I still have a lot of things I don't know. And then the classes are meant like the general class, which I believe, and I think for me, it should be like stage by stage for me.
Right. Okay.
And so,
hello.
like, yeah.
Okay. Sorry. I think I get what you are saying. I'm sorry to interrupt.
Okay.
If you go to the YouTube, we have all the questions you might need to ask concerning the stage you are in. We have treated them in some time past. So we are just, going round and round. So it depends on the time you join the class. The time you join the class may not be the time that is treating what you are experiencing at your stage. But if you check on the YouTube Mother and Child Hospital website, you will find all these other things. You can, maybe some of your questions will be answered. And if not, then when you come for your antenatal clinic, you can ask for the matron, and then you can ask me any question you want to ask.
Okay, for instance, now I don't know the matron, I don't know the name of the matron.
When you get to
the first time.
Okay, you know what I do for some first timers, when I see them at the reception, I ask them if they are linked with our antenatal class. Most of them will say, no, I'm not informed. So I'll take them to the front desk people. They will take her details and then invite her. But when you get to the clinic, just ask for Mrs. Additional.
Okay.
And thank you.
All right, thank you.
Okay, so I hope that answered your question. But as you stated clearly, many people are in different stages of their pregnancy. I know that what you need now may be what you need in the first trimester. But all our classes are recorded. If you have any challenges, just let us know. We can get you to watch the videos. Or if you have any questions, feel free to ask us. Okay, we'll address all your concerns. All right.
All right, thank
Do
you.
you have any concern today that you think you want us to address? You want to
No,
wait?
no.
Okay.
No, not at all. Thank you.
So we'll send you the link to all our previous classes so that you can go through them. And if it doesn't answer your question, please feel free to reach out to us. We are very available to answer any of your questions.
All right, thank you so much.
You're welcome now. Okay, so any more questions? None?
Good morning, doctor. Can you hear me? Hello?
Good morning, I can hear you.
Good morning, doctor. I want to talk about the forceful feeding, like not forcing your child.
Any more questions? Any more questions?
No.
Okay, all right.
Yeah, I'm talking. Hello? Hello?
She's listening.
Okay.
She's listening.
I'm
I
here.
want to talk about the forceful feeding, not forcing your child to feed. What
Yeah.
about those kids that does not even want anything than breast milk? And you said at 6 months we should be introducing few things to them. That I know of a child that till now, I think she's about 1 year. If we're about to feed her, she cries all through, and we have to sometimes force her. So what do we do in that situation?
All right.
Like,
So
she
okay.
does not want anything apart from breast milk.
Breast milk. All right. Okay. So I mentioned earlier that for the first 6 months of life, breast milk is okay. But from 6 months to 1 year, it provides only half of what the child needs. So that means the child who is still being breastfed only after 6 months is more prone to becoming malnourished. Now, I know some children are picky eaters. I had to work with some children who can be very frustrating to work with them because their parents will be frustrated and everything. But there are ways we go around it. That's why I say you don't work. They're not alone. There are ways we have been able to get around feeding this kind of children. But why we say don't force feed, because Force feeding, if that gets into the child's airway, that child can die. So you don't want her to, you want to feed her, but you don't want her to die. So I'm saying we can walk around. There are different ways we walk around trying to feed those kind of kids. It can be maybe a new caregiver. Sometimes some children are so familiar with their parents, they won't take food from them. Maybe someone. Okay. Sometimes you've tried that before. So some children tend to eat better when they're out of the house. So we try to say, okay, let the most of the foods be taken out. Then when they get home, we can see how to walk around it. Sometimes we have to try different techniques. Sometimes we need some form of distraction. So every child, different things work for different children. That kind of child can bring her to come and see us, and we can help you to work with that kind of a child. We work with so many of them who have started adding weight over time. So there are different techniques, but there's no one size fits all. Every child is unique in his or her own way. So if we can work with that child, we can bring and we can work with the child and see. But as I said, there are different ways to go around dealing with picky eaters. Okay. Without having to force feeding. Right?
Oh, okay. Thank you, doctor.
All right.
Then one more thing, doctor.
Yes.
Concerning the first-time mom that do not know about the ongoing classes, antenatal classes, I feel the management or the gynae should be able to lead the first-time moms through as well. I'm also a victim of this.
Okay.
Yes, maybe at a certain week, the gynae should be able to ask, have you joined the antenatal class? My gynae never asked me, and I thought maybe it's when it gets to a certain stage, that is when I joined the antenatal class. And I was shocked that I've missed a lot of things.
Oh, wow. Okay.
Yeah.
So sorry about that.
Thank you.
All right. So we'll try. Thank you for your feedback. We'll try and.
Yes, we will take care of it. Thank you.
All right. Thank you.
Hello, doctor. Good morning.
Good morning, ma'am.
I'm Mrs. Gaba Timothy.
Okay. Nice to hear from you.
Thank you, doctor. We appreciate your efforts.
Thank you, ma'am.
Okay, I have a question.
Okay.
I have two babies. I gave birth to twins.
Oh, wow. So, congratulations.
Thank you. I'm unable to do exclusive breastfeeding.
Okay.
So I'm augmenting the breast milk with the formula.
Okay.
Okay, but I noticed, I don't know if there's anything I'm doing wrong. You know, during this their colic period,
okay,
they struggle with their processes and all that. And eventually, each time they fart, the smell is something different. So it's just like an adult fart. You hardly sit whenever they fart. So you must want to throw up, or maybe it feels so uncomfortable. So I'm asking, in the formula I'm giving, is there anything I'm doing wrong that is causing the smelling of the farting?
Okay. So how old are your children?
They are just 2 months yesterday.
So not necessarily that you're doing something wrong. No. Sometimes when children fart, it tends to smell. They're taking milk, so you can understand the reason why. Okay, you can take milk for 1 week and see it if your fat will also not smell. I don't think you're
in fact, you take protein. When you take proteinous food, if you fat, you will almost run away from yourself.
So that's the thing. You're taking milk. As long as I know that it's not easy to exclusively breastfeed twins. You don't want them to starve. As long as you're mixing the food, because every formula has a particular way the food is mixed. So it's not a particular meal to a particular number of scoops. Are you doing it properly?
Yes.
So mothers just pour water, pour milk, and shake and just start moving. Everything.
They said 30 ml for a spoon, 60 ml for 2 spoons, 90 ml for 3 spoons, and so on. So that's the way we are going about it.
Yeah. So you're not doing anything wrong. It happens. But for colic, I always tell mothers that for colic, there's really no. So colic happens, usually starts from about 10 days to 2 weeks, and usually peaks at about 6 weeks, and usually resolve around 3 months. And most times what we advise is that there's really no medicine for colic, but after eating, let your children burp. So let put them on your bed, but once they are able to burp, it helps with the colic to bring it down. Okay, we don't give Infacol, we don't give breast water, we don't give nospamin. Just let it run its course, it will go. Okay, children have colic, whether they are breastfed or not, they will have colic. Okay, so it's something that should resolve by 3 months. But if you said like swelling of the abdomen, passing bloody stool, then that's not straightforward anymore. Can bring the child for us to see. Okay.
All right, doctor.
But fat smells, trust me. If you take milk for 1 week and experiment, come back and let me know what the results you get.
All right. Thank you,
All
doctor.
right. You're welcome, ma'am. Okay. Any other questions? So I just forgot to mention something about breastfeeding. Now, most mothers breastfeed lying down. I don't know who does that amongst us. We don't really like it so much because once when that happens, milk can drip from the mouth into the child's ear and leads to ear infections. Okay, and then sometimes it can lead to the child can aspirate, so it can cause like respiratory tract infections. So we usually don't advocate for lying down to breastfeed. If we can try to avoid it, the better for us. It's not usually safe for the baby. That's one thing I forgot to mention. All right. So no more questions. Or when you see me, if you have any questions, please, if you come to another, feel free to walk up to me and ask me any question. Please forget to ask anything now. Just ask Sophia, and I'm around. I can answer any of your questions on the go in case you have nothing to ask for today. I'm always available to answer any of your questions.
Sorry, doctor.
Yes.
Which of the branches are you? Adeni Jones.
I'm in both branches. So I'm in Adeni Jones on Monday and Thursday. I'm in Omole Tuesday, Wednesday, and Friday.
Okay, okay.
And then if you need to speak to any nurse at all, in Adeni Jones, there is Mrs. Emenalo. She's the matron in charge. Please, you can ask for her and ask your questions. And if you do use Omole, ask for Mrs. Adeshino. She's also the matron there.
Okay.
You're welcome.
All right, ma. Thank you.
Yes.
So thank you so much for your time.
Thank you, doctor.
Rest well, eat your food well,
Thank
and then
you,
take care
doctor.
of yourselves. And wish you a safe delivery whenever you put to bed.
Thank you.
Amen.
All right.
Thank
so have
you.
a lovely weekend.
Bye.
Bye. Thank you.
Bye.
Bye.